Pleased to be joined now by Daisy Cooper, the Liberal Democrat MP and Health. Hi Daisy, good to see you. We've just come through a terrible, terrible pandemic. Could that be to blame for widening health inequalities and flatlining life expectancy?
Well, the pandemic clearly has set our health and care services back, but there's no doubt that they were being run into the ground for years and years and years by the Conservative government well before the pandemic arrived. The fact is that everyone knows that it's hard to get an appointment with a GP, it's hard to get, or near impossible to get an appointment with a dentist. When people call ambulances, they often don't arrive for hours. And it's hugely frustrating that this is now being seen in terms of the statistics that people are so familiar with, which is now we are no longer becoming a healthier country, we are becoming a more ill country. And if we want to increase growth, if we want to be a productive economy, then we absolutely have to invest in our health and social care services.
Specific terms, Daisy, that they've identified. I mean, we know that cancer is largely a disease of old age, and there's been a great discussion, of course, about the lack of cancer screening because of the pandemic.
Well, one of the things that MPs have been calling on the government to do is to roll out more diagnostic capability and to have more diagnostic hubs, including those that can actually travel around the country. That would be a really important investment that the government could make to actually accelerate diagnostic tests so we can actually tackle that cancer backlog in particular. You're right to highlight the issue related to cancer, but of course this is right across the board. There are backlogs for all sorts of different medical conditions, and quite frankly we have a workforce at the moment that is understaffed because there are so many vacancies. They are overstretched, they are exhausted from the pandemic, and it's unbelievable that the Conservative government actually spent 8 months fighting a cross-party coalition in Parliament when we were calling for the government to have a legal obligation to publish workforce projections every single year so we knew how many staff we actually needed. The government spent months and months and months fighting that needlessly. Had they accepted it, we could have started planning for the future. We could have said to our health and social care workforce, the cavalry is coming. But the government has refused to do that. So clearly the backlog is a major issue, but the government isn't taking the quick wins that many organisations and patient groups are calling for.
Alarming health story to do with the workplace shortages that you identified. Today, figures revealing there are 165,000 vacancies in the adult social care sector. They need a pay rise, surely?
You're absolutely right. Yes, they do need a pay rise. And I think across the board, Liberal Democrats would like to see workers getting a pay rise as close to inflation as is possible. There's a number of particular problems facing the social care sector. The first is that it's not really promoted as a career. The second is that it's not competitive. We have social care workers leaving social care and going into the NHS because similar roles are more competitive and pay more even in the NHS. We have lots of social care workers leaving health and social care altogether and going to work in hospitality because they can get better pay there. And if we as a country value social care, which we should, because care is so important to so many people, it enables them to lead their lives. If we really care about social care, we do need to see a pay rise for social care workers. We need to see professional development, we need to see career progression, and we see better employment practices that help keep those people who are in social care staying in the profession for the long term. We need to have a long-term plan for social care, and at the moment the government just keeps offering quick fix plasters that are not fixing the underlying problems.
Daisy Cooper, Liberal Democrat MP and Health spokesperson, thanks for your time today.